Greetings! I see that you clicked on this video to be able to know more about rheumatic heart disease. Well, without further ado, let's get on with the explanation. For you to be able to identify and visualize what really happens when someone acquires this disease, I'll be using illustrations in order to do so. Rheumatic heart disease results from rheumatic fever that leads to long-term damage to the heart. Rheumatic fever is an inflammatory complication caused by Group A streptococcal pharyngeal infection. The peak age of developing streptococcal pharyngeal infection is between 5 to 15 years of age, wherein similarly, the first episode of acute rheumatic fever occurs. This means that development of rheumatic heart disease due to untreated or poorly treated rheumatic fever is most common among the school age to adolescents population group. So what happens during rheumatic heart disease? Strep A bacteria causes an infection in the throat or skin. If this is left untreated, then after a few weeks, the Group A streptococcal infection or gas still occurs. There might be an abnormal immune response to the infection. This inflammatory response can result in acute rheumatic fever, and repeated Strep A infection can trigger more episodes of acute rheumatic fever called recurrent acute rheumatic fever. Remember that each time this happens, there will be more damage done to the heart valves, and there are 4 valves in our heart: the mitral valve, the tricuspid valve, aortic valve, and the pulmonary valve. But most commonly, RHD affects the left side valves of the heart, as inflammation of these valves can cause stretching and thickening of the valve leaflets. And as this continuously occurs, the rheumatic heart disease can get progressively worse as signs and symptoms starts to occur. So as mentioned earlier in this brochure, the common signs and symptoms are chest discomfort, heart palpitations, shortness of breath, fatigue, or weakness, and more. Clinical findings that will be seen during hospitalization might also include hemoptysis or blood-tinged sputum due to severe coughing, orthopnea or breathlessness in the recumbent position or when lying down, paroxysmal nocturnal dyspnea or severe shortness of breath and coughing that generally occurs at night, peripheral edema, chronic malnutrition, stroke, syncope, or fainting due to decreased blood flow to the brain. Who are at risk of acquiring this disease, you may ask? Well, please continue until the end of this interactive brochure to find out more.